I'm Janelle, I'm a Cedar Crest nursing student. I chose to do my evidence-based poster project on music therapy and cancer-related pain and anxiety. So the reason I chose to do this is I feel like cancer is affecting more and more people every day, and more people are being diagnosed with it. The National Institute of Cancer even predicted that this year alone 1.6 million people will be newly diagnosed with cancer. And with that new diagnosis comes feelings like pain and anxiety from new procedures, going through chemo, the thoughts of surgery, not knowing how their cancer is going to be managed. And as a nurse, I feel like it's really important to learn new ways, not just medication ways or pharmaceutical ways to manage these pain and anxiety symptoms. So I became really interested in the use of music therapy. Also a concern with all these increased diagnoses of cancer would be the cost to healthcare. And the National Institute of Cancer also provided a projection in 2020 of the cost to be $174 billion to maintain in the maintenance of cancer diagnoses. So one interesting thought that I had was with music therapy, we can lower the cost because music therapy is being found to lower the amount of medications needed to control pain and anxiety levels, which could save patients money with prescriptions or to the hospital money with treating these symptoms. So this brings me to my clinical question. My clinical question is, in hospitalized patients with cancer, does the use of complementary music therapy compared to just pharmacological intervention without musical therapy decrease pain and anxiety levels? So the way I did this is I performed a search strategy using the databases of EBSCO, CINAHL, PsycInfo, and PubMed. I used the keywords of pain, anxiety, cancer, and music therapy. I limited these results by making the timeline of 2010 to 2016 in the last 6 years, and only finding full text articles. And in this I found 37 results, and of these 7 results I synthesized to 3 studies as listed here that really address my PICO question. So my first study is for Polton, McGovern, and Silverman, and the purpose was to see how just a short-term intervention of music therapy would affect pain and anxiety, also relaxation and nausea, and the response to music therapy. So what they found with the pre-post test and follow-up scores is a greater reduction on the short term in post-surgical cancer patients in pain, anxiety, and relaxation. So in my next study of Tai et al., his purpose was to really evaluate and synthesize the evidence behind music therapy treating pain, anxiety, nausea, fatigue, and depression. So in his study, he took studies from 2002 to 2012 and synthesized them. He used the Cochrane collaboration guidelines and a formula devised by Hedges and Oken, and in his findings he found that music therapy really helped treat pain, anxiety, and also fatigue. So in my next study, Kashani and Nair, the purpose was to see if they could reproduce these effects in India with their palliative care patients that were being mostly treated for the ailments of pain and anxiety. So the way they did this is using a pre and post test, and in the control group they just talked to them for 20 minutes. In the experimental group they would do music therapy through headphones for 20 minutes. And in their findings they found that music therapy caused a significant reduction in the amount of morphine needed to control their pain and anxiety, and also reduced the numeric pain score by 2 points, like 1.5 to 2 points, but didn't really decrease the amount of anxiety in relation to the control group. So in my recommendations, I recommended that a 20-minute music intervention will decrease anxiety and pain. This can be carried on through the nurse. Allowing patients to pick music and pick their own music intervention, and using music interventions with adults would yield better results. My third recommendation would be a single session of music therapy would help patients who are, for example, on morphine decrease the amount of morphine needed to control their moderate to severe pain. In my conclusions, music interventions were significantly effective in treating anxiety, fatigue, and Pain, randomized control groups, better way to measure anxiety would really improve the applicability to the floor. And music therapy causes significant reduction in pain scores of patients already on morphine, but did not really prove that music therapy could really help anxiety. And this is my poster project.